In this analysis, we're looking at the social determinants of health, where we look at the population that reports poor or fair health and consider some of the factors that may be related to that. So the rate of poor or fair health is the percentage of adults aged 18 years or older who report fair or poor overall health. And we can see this percentage, the reported percentage reported for each of the states in the United States. If we zoom out, click on the minus sign, we can zoom out and we can see the results for Hawaii and Alaska as well. So the color coding on each of the states represents the percentage where the lighter color shades of blue are lower percentage of populations that report poor or fair health. And the darker shades of blue represents those states that have a median percentage of a higher median percentage of individuals who report fair or poor health. So if we click on a state, let's click on Alaska. So if we click on Alaska, we see, put our mouse over Alaska, we can see the state of Alaska. The population in Alaska shows that 17% of that population reports fair or poor health. And then this bar chart below shows all the counties within the selected state, in this case Alaska, and in descending order shows the percentage of the population that is reporting fair or poor health. If we scroll down further, we can see, looking at the population that's reporting for poor or fair health and comparing that to the overall population of that county. So we can see if there's a relationship between poor and fair health and the size of the population for that county. Next, we take a look at poor or fair health reporting versus child poverty. So this is child poverty is the percentage of children under the age of 18 that are living in poverty, where poverty status is defined by the family, where they're in the indicator for that size of family. And you can see that that range is from 0 to approximately 30%. And then we look at reported poor or fair health compared to mental distress. So mental distress is the percentage of adults who reported 14 or more days in which they feel that they have stress, depression, or problems with emotions over the past 30 days. So the higher the rate, the poorer the mental health. And then finally, the looking at poor or fair health reporting versus excessive drinking. Now, excessive drinking, this is the percentage of adults that report either binge drinking, which is defined as consuming more than four or more alcoholic beverages on a single occasion for women, or 5 for men in the past 30 days. Or it can be considered heavy drinking, which is defined as drinking more than 1 for women or 2 for men drinks per day on average. So the higher, we can see that the percentage of the population that's reporting excessive drinking is between 0 and about 20%. And we can compare that rate versus the percentage of the population that are reporting poor or fair health. So we can see, again, this is for the results for the state of Alaska. Now, if we if we click on Alaska again, we then the results are updated, and now we see the results for the entire United States, all counties in descending order, and then we can see the results for population, child poverty, mental distress, and excessive drinking. So you can look at this for specific states or even specific counties within a state. So if we select another state, let's select Idaho. So with Idaho, if we click on a specific county, we can see the result for that county highlighted with all the other counties in that state indicated, but in a shade of gray. So click on the county again, we can see all the results. click on the state again, we can see the results for across the United States. So you can try this with different states, different counties, and take a look at the relationships between poor or fair health and population size, child poverty rate, mental distress frequency, and excessive drinking.